City issuing a strong recommendation that even vaccinated people start wearing masks again indoors. And all this comes as the latest guidelines from the CDC show that all 5 boroughs are high transmission areas. It is also recommending residents mask up regardless of vaccine status.
This as the city turns a major corner when it comes to vaccines. Listen here.
We have hit a major milestone over the weekend. Very proud of all our colleagues at Department of Health and Hospitals and Test and Trace and everyone out there who's been part of this amazing, amazing effort. Over the weekend, we passed the 10 million dose mark in New York City. 10 million and growing. As of today, 10,003,019 vaccinations given in this city, doses given in this city. Look, this is a very powerful moment.
The city's vaccination rate has slowed down significantly, though, and here to tell us what is being done to turn those numbers around is the head of the city's Test and Trace Corps, Dr. Ted Long. So welcome back, Dr. Long. Been a minute.
Good morning.
Thanks for having me, as always.
Yeah, so it sounds like there's good news and bad news here, right? Good news being that we surpassed the 10 million mark. The bad news that vaccine rates have slowed down significantly as the Delta variant picks up here. How does that change the fight against the virus here?
Yeah, that's a great question. So just to give the backdrop to this, we know what's going on here. The Delta variant is everywhere in New York City now. It's the majority of our cases. We know what we need to do to defeat it. We need to get New Yorkers vaccinated. We need to have New Yorkers continue to get tested. And when one of our contact tracers calls you on the phone, we need you to pick up that phone and tell us who you may have exposed to the virus. If we do those 3 things and continue to wear our masks, as we strongly recommend, we will defeat the Delta virus. But it is a race. And that's why I'm happy to tell you a little bit more about today, what we're doing to help New Yorkers to get vaccinated.
Yeah, so let's talk about that. The New York City COVID Safe app launched, just a few days ago. Do you have any indication how many people have actually downloaded the app and are using it so far?
I don't have those numbers off the top of my head, but what I can tell you, in terms of what we're doing to help to encourage New Yorkers to get vaccinated. Right now in New York City, we've led the way on this. We're giving you $100 if you come to any one of our city-run vaccine sites. And one program I really want you to take note of and write down, nyc.gov/home vaccine. If you log on to that website, we will literally come to your house to give you the vaccine. In terms of the numbers you're referring to there, New Yorkers know the Delta virus is here, and New Yorkers know that we're giving $100 per vaccine. Put those 2 things together, and with our mobile units to go around New York City every day, we've recently seen nearly twice the number of New Yorkers starting to come out to get vaccinated today, as opposed to a few weeks ago.
Right.
So New Yorkers have kept our city safe the whole way through, and I see it happening again now.
Yeah, and every number certainly helps, and every incentive certainly helps as well to get people vaccinated. What is then, Doctor, the numbers of people who have gotten vaccinated since the $100 incentive came out? I saw there were a couple tweets over the weekend that kind of gave those numbers. It was a few hundred, then it was a few thousand. What is it today?
Yeah, well, it's on the order of thousands. But again, with our more than 30 mobile units going around the city, we've doubled the number of vaccines that we're giving through those units. So something has changed. I do think it's the incentive. Plus, I do think New Yorkers see what's going on in our city, see cases going up, and know that the way to fight the Delta virus, and I hope we've been clear in this, is to get vaccinated. If everybody in New York City gets vaccinated, the Delta virus will be defeated and COVID will be defeated as well.
And in that fight, though, is the Test and Trace Corps. And I know that you're talking about people, telling you who they've come in contact with. That's been a problem, though, especially throughout the height of the pandemic. People really didn't want to say. Is that getting any easier? Are people being more forthcoming?
Yeah, so I think New Yorkers, in my opinion, have taken the coronavirus pandemic seriously the whole way through. You look in New York City, even in the video you're playing there, people are wearing their masks. And we've identified literally millions of close contacts from people that are cases with the coronavirus. We've reached out to them, had more than 20,000 come to our hotel program alone, which is a definitive way to make sure you aren't transmitting the virus to others. And also with the questions we're asking New Yorkers, it enables us to know where transmission is happening. So we know that we see the sharpest uptick in transmission today in gatherings. That's why yesterday we put out our strong recommendation to wear masks outdoors and indoors, vaccinated or unvaccinated, driven by what we're seeing in our contact tracing data. We know that's where transmission is happening. We know it will work.
Right, but you've always had some issues along the pandemic with reaching specific communities, right? Black and brown communities, poor neighborhoods who have said, what about us here? What is the outreach for those specific neighborhoods who right now may have low vaccination rates? How are you reaching out to those specifically?
For communities with low vaccination rates, that's why we've built up the largest mobile fleet anywhere in the country, both mobile testing units and mobile vaccine units. If there's a community that has low vaccination rates, we don't wait. We literally drive, and I can see you have one of our mobile buses here, one of our mobile mini buses, large buses into your community. I've been to our communities myself. I see people coming out in droves to our mobile units. That's what it takes, though. From my view, our role here is to do everything we can to help New Yorkers to have access and make the easy decision to get the free vaccine. But I'm encouraged over the last few weeks about how many more New Yorkers are getting vaccinated now.
What's the number one,
I can never force
Doctor,
anybody to get vaccinated. I can just make it easy, and you are coming out.
What's the number one thing you're hearing from people right now when you go into those communities then? What's the number one thing you hear that says, I don't want to get the vaccine, right? Because there's been a lot of mistrust along the way, and people are saying, I'm still not getting it. What's the number one thing? We're almost out of time.
The number one thing I'm hearing is that people still want more time to make sure the vaccine is safe for them. But as I tell my patients, because my patients tell me the same thing, Delta variant is here, and that changes the ballgame. This thing is as contagious as chickenpox. So if you've been waiting for that additional reason to get the vaccine, that is the reason you've been waiting for. My patients have been listening and have been getting vaccinated, and I'm seeing start to happen across New York City now. So please know, the Delta virus is here. It is what's being transmitted throughout the city. But the good news is it's not too late. If you get vaccinated today, and if enough New Yorkers get vaccinated, we will beat this.
All right, Dr. Ted Long, thank you so much for your information and all the good work that you're doing to get people vaccinated. We appreciate it.
You're very welcome. Thanks for having me.